Hello and welcome to the 4,400 doctors of veterinary medicine who registered for today's popular event. Thank you for joining us today on Jeunesse Castonguay. We're excited to welcome back the fabulous ultrasonography educator, Dr. Camilla Edwards, for today's webinar, Practical Small Animal Ultrasound, where we'll cover critical AFAST scanning techniques. Today's session is race approved, thanks to the Vet Show. So please do stay on for the full webinar to qualify for one CE CPD credit, which you'll be able to redeem via the Vet Show in the coming days. We're also very excited to welcome back Bourbon for live canine scanning following the presentation, so stay tuned. Shortly, Dr. Edwards will be sharing abdominal FAST exam best practices that save lives in canine and feline emergencies. But first, it's my pleasure to introduce you to your host. We're welcoming back Dr. Aron Frankel, who's trained in emergency medicine in California. A passionate POCUS educator, Dr. Frankel has been using point-of-care ultrasound his entire career. He practices in a busy academic teaching hospital in Vancouver as an emergency physician. When he's not saving lives, Dr. Frankel serves as the chairman of our medical advisory board. Dr. Frankel, please join us.
Thanks so much, Jeunesse. It's good to be back. Before we jump into today's topic, which is near and dear to my heart, even though it crosses species boundaries, first a quick thank you to Dr. Greg Lisandro, who's the creator of the standardized FAST exams that we'll be covering today. And we'd like to start the webinar by really thanking him. The AFAST is the proprietary element of fastvet.com, which is a website that's been set up for educational purposes to uphold excellence in teaching standards. And it's owned by Dr. Greg and Stephanie Lisandro. And there's an annual membership with race-approved courses for multiple different FAST applications. And you can also purchase the excellent book on Amazon.com, which presents a standardized approach to focus point-of-care ultrasound in veterinary practice. You know, in our quick literature review for today's topic, we covered a bit around the FAST exam. And we know, I know from the human world that since the 1990s, the FAST exam has been used for injury surveillance in people with blunt and penetrating trauma. And in humans, it's become an integral part of our curriculum for emergency and critical care physicians. And as applied to veterinary practice over the years, these techniques now provide a great extension of the physical examination for emergency and critical care veterinary applications that potentially can expedite diagnosis, prompt life-saving maneuvers, and guide patient management. What we've found over the years, what's quite interesting is that, you know, the original FAST was set up to detect free fluid in the abdomen and in the thoracic cavities. And it's been shown over and over again, particularly to be superior to radiography, not only for the detection of fluid, but also what's interesting is the volume through these special applied fluid scoring systems. And the AFAST study specifically documented that the simple abdominal fluid scoring system reliably predicted the degree of anticipated anemia in dogs with hemoabdomen. Going beyond that, we know that the advantages of using point-of-care ultrasound in the human and now in the veterinary world is that it really provides information in real time for free fluid and soft tissue abnormalities that can be detected beyond the physical examination in the abdomen, heart, and lung, which are often missed or only suspected when we just lay our hands and stethoscopes on our patients, and what we have available through basic blood and urine testing and radiography. And what's even more that advantages of using the ultrasound is that it's point of care, it's cage side, low impact, rapid, safe, radiation sparing, requires no shaving and or minimal patient restraint, which what I've learned in especially accessing in the veterinary world can be really important in your critically ill patients. And so before we jump in, just a quick poll to see where everyone is at, because we want to better understand our audience, which is how frequently do you use the AFAST exam in your practice? We're going to load up this poll and leave it for a couple seconds here. So are you just learning? Is this something you rarely do? Are you doing it monthly, weekly, daily? And all right, maybe we'll shut it down and just kind of see where everyone's at. So across the international spectrum, we have about half. I would say maybe 3/4, close to 3/4 in the beginner spectrum. We're just learning and rarely using it. And I can't think of a better person to kind of launch us into how to bring this practice deeper into your clinical encounters than Dr. Camilla Edwards. Dr. Camilla graduated from KVL in Denmark in 2006. She worked in general practice and emergency and critical care in the UK. She achieved her certificate in advanced veterinary practice in 2018, and she started her company First Opinion Veterinary Ultrasound in 2018, where she scans for general practices in the UK, reviews ultrasound machines, teaches ultrasound, and runs a very active Facebook community with 2,000 plus vets interested in ultrasound. Dr. Camilla, we're so happy to have you back, and I'm going to hand it over to you.
Thanks very much, Sharon. Right. So I'm going to talk to you today about abdominal fast scanning. So what will we learn in this webinar? We're going to look at what AFAST is, when to use it, how to do it, and we'll have a look at some of the common pitfalls and how to avoid them. And then I'm going to look at a couple of case examples at the end. So we're assuming that you have some basic knowledge about ultrasound machine setup and basic anatomy. But you can get this basic knowledge quite easily. So don't be afraid to pick up the ultrasound probe and give it a go. So we'll start with abdominal fast scanning. So what is abdominal fast scanning? Well, it stands for Abdominal Focused Assessment Using Sonography in Trauma. That was the original name, but we've added triage and tracking because we've found that it's so useful, not just for those trauma cases, but for triaging when cases come in as emergencies, and for tracking cases, how they're progressing. Are cases getting worse or are they improving? As Oren said, it started in emergency rooms. Søren Boysen was critical in bringing it to the veterinary world, and Scandro in 2009 showed that the AFAST scoring system showed the degree of bleeding and predicted the degree of anemia. So that was really useful. But we've progressed to using this in animals who have had not only had trauma, but also to those animals where we suspect anaphylaxis, pericardial effusions, pleural effusions, non-traumatic hemabdomens, and peritonitis. So what can abdominal fast scanning do? Well, as Oren said, it detects small amount of free fluid in the peritoneal, retroperitoneal, pleural, and pericardial spaces. And it can detect as little as 2 to 3 mils per kilo of free fluid. And that's just something that X-ray just cannot achieve. We can also predict the degree of anemia in traumatic hemabdomens in particular. And we can serially monitor for occult hemorrhage post-interventions such as biopsies or surgeries. And in addition to that, AFAST has been shown to help screen for anaphylaxis by looking at the halo effect on the gallbladder. We can use it to look at right-sided cardiac function by looking at the caudal vena cava size and assessing volume status, and also looking at urinary bladder integrity. What can abdominal fast scanning not do? So it's important to know its limitations. That's really critical because we don't want to overinterpret what we're seeing. So we can't tell what the type of free fluid is without sampling. We can just say that there is free fluid within the abdomen. We need to do an abdominocentesis to be able to actually say what the type of fluid is. And it does lack some sensitivity in penetrating trauma cases. In severely dehydrated and hypotensive patients, we can get some false results. So we can assume that there's no free fluid, but actually there is free fluid when you rehydrate. So it's important to check again after you've resuscitated and rehydrated your patients. It cannot replace a full abdominal ultrasound exam. We're looking at 4 points in the abdomen. We're not looking at all the organs. So the pros with AFAST scanning is that it's safe, it's non-invasive, it's quick, you can answer some clinically important questions very quickly, and particularly for respiratory distress patients, they can be assessed in their most comfortable position and while they're receiving other therapies. So, for example, you can have someone administering oxygen, someone placing an IV catheter, all while someone else is doing an AFAST scan. You can't do that while an X-ray is going on. And with an X-ray, you need to lie them on their side. This is just far superior to X-ray in looking for free fluid in the abdomen. So the cons with AFAST scanning are that it is limited. It doesn't assess the whole abdomen, and you can't assess the type of free fluid. It may be less reliable in detecting free fluid in dehydrated or hypertensive dogs, and it might not be accurate with cats, because we may be thinking about in a blunt trauma in a cat that it's a hemo abdomen, whereas actually they're more likely to get a uroabdomen. So you have to really assess what type of fluid we've got in there. Also, if we're looking through past the liver into the thoracic space, if there's deep lung disease without a peripheral component, we won't be able to detect that. So when can we use it? So particularly in our trauma cases and our emergency cases, if we've got blunt and penetrating traumas, if we've got collapsed patients coming in, but then we can use it in other scenarios as well, where we've got unexplained anemias. We should be looking, is there a bleed? These can be quite chronic cases. We should be looking post-intervention. If we're worried that an animal isn't recovering from an operation as it should be, we should be considering doing an AFAST scan, looking for free fluid. Particularly in those cases, because we'd expect possibly a small amount of free fluid post-surgery, is that free fluid getting worse? Yeah, so also think cases that are at risk of bleeding post-surgery or peritonitis, particularly with that. And suspected peritonitis and all those animals that are just not doing right, pop a probe on their abdomen.
Yeah, I would just chip, you know, from my perspective, it's if you're ever going to touch the abdomen, you should just be doing it with an ultrasound probe, right? If it's ever part of your exam, you're going to learn so much more with the probe in your hand than your fingers.
Yeah, it's just an extension of your clinical exam, really. Yeah. So talking about preparing the patient, as Oren mentioned, it's really simple. You know, normally with ultrasound, we need to clip the whole animal, but we're going to 4 specific points on the abdomen. So all we need to do is part the fur, place some alcohol in the area and lots of gel, and then you should get a good enough image to see if there's fluid there. So with AFAST, we usually do that in right lateral recumbency. And this is important when we're sort of doing the fluid scoring, that's a consistent position that we're doing that in, and gravity plays its part in that fluid scoring system. However, if we've got an animal in respiratory distress, it should be performed in the position that they're most comfortable, and that's most likely to be sternal. So let's have a look at those 4 positions for the probe. So the first position is a diaphragmatico-hepatic view. So we put the probe just behind the xiphisternum and we aim cranially through the liver, and we can see into the thoracic cavity too from this view. The second is the splenorenal, and we're looking at the left kidney, and that's where the spleen is as well, up at the top of the costal arch, where it meets the lumbar musculature, just below that. The third view, the systocolic, so we're looking at the bladder, through the bladder, towards the descending colon. And the fourth view has changed a bit. So it started originally as the hepatorenal view, and we used to stretch under the dog, and that's something I'm going to demonstrate in the video. But it changed because it's difficult to maneuver underneath an animal. So for the fluid scoring system, we now scan much closer to the umbilicus, and the name changed to hepatorenal, and it's recently changed to splenointestinal umbilical, because that's actually what you're going to see in that view. You'll see the spleen, you'll see some intestines, and you're at the umbilicus. And then there's the bonus view to, if you can get the hepatorenal, you don't have to do that while they're lying. You can do that standing or when they're upright. That doesn't count in the fluid scoring system anymore. So here's a little video, me demonstrating on my dog Pippi. So this is the diaphragmatico-hepatic view. We're looking through the liver and into the thoracic space as well, ahead of that. So we've got the diaphragm here, liver here, and we're really looking at this white line. Is there any black line next to it? The second view we'll look at is the splenorenal view. So place the probe high up on there, and we've got the spleen here, and we've got the left kidney here. And for each of these views, we look at the organ, and then we fan through, and then we rock cranially, and then we go back to our original position. So here I'm going between the back legs to look at the bladder, this large black organ here filled with fluid, and then we'll look through to the colon, which are these white, this white organ with the shadow beneath it. And then we can see the bladder popping back into view. So then we'll have a look at the hepatorenal view, where we look for the splenointestinal umbilical view, where we see a bit of spleen and some loops of intestine. And this is a really good view for finding small amounts of fluid, because this is the lowest point towards the table. Gravity will be pulling it down. So the final bonus view, the hepatorenal view, where we're looking for the right kidney here. I've just rolled Pippi up. It's much easier than pushing underneath, but you can see in an animal that's been traumatized, they're not going to tolerate that quite so well. And it can be really uncomfortable, particularly if it's a large dog getting underneath them. So what are you looking for on the scan? So the main thing is that you're looking for fluid. And this is anechoic, which means black. There's no sound signals coming back, so it produces a black image. And the difference we want to know is between normal fluid that we might find particularly in perhaps the gastrointestinal tract, in the gallbladder, in the urinary bladder. That will often take a rounded shape. The organ will fill and it will round out. Whereas free fluid will fill up all the spaces, and you'll get sharp angles. So you'll get triangles, squares, lots of sharp edged shapes will be free fluid. So I talked a little bit about the fluid scoring system developed by Liscandro in 2009. And what we do is we score at each site. So the diaphragmatic-hepatic, the splenorenal, the cystocolic, and the splenointestinal umbilical view. And we give each of those areas a score, either 0, half, or 1. And 0 means no fluid was seen in that area, so no black triangles in that area. Half is if we see some fluid, but it's less than 5 millimeters in a cat or less than a centimeter in a dog. And we give a score of 1 if it's over 5 millimeters in cats or over 1 centimeter in dogs. But really, you don't have to measure it. It's an eyeballing technique. This is not about being perfect. It's about getting an idea of what's going on in the animal. And we add up the results to get a score. And this is particularly for our blunt trauma cases. So you can have a score that is between 0, which would mean negative, no free fluid at any of the sites, or you can get up to a score of 4, which means there's an awful lot of fluid in the abdomen. And it's been shown that if it's under 3, then that's 3 positive points, then it's a small bleeder, and if it's above 3, then it's a big bleeder, and that correlates with the anemia that we'll see on a blood test result, and also correlates with whether we need to think about doing a blood transfusion or not. So just to give you an idea of what that will look like in these fluid scoring systems. So we've got the diaphragmatico-hepatic view. I've taken an example of a 0, a half, and a 1, just so you can see the difference. So we've got the liver here, we've got the diaphragm here, and in this case we can see the heart pumping away there as well. And you can get an idea that you can actually see, you might be able to see fluid in the abdomen on the right hand side of this diaphragmatic line, the bright white line here, but you might also see pleural fluid, or you might see a pericardial effusion as well. But this is a score of 0. The only fluid we're seeing here are within the chambers of the heart, where there should be fluid, and the gallbladder, which just pops into view. Let's just see it in a moment. There, it just popped into view there. So that's a score of 0. Then we look to a score of half. And again, we've got the heart pumping here. We've got fluid within the chambers of the heart. We've got the diaphragmatic line here, and we've got the liver here. Can actually see a little bit of fluid in some blood vessels there as well. So we have to not mistake that for free fluid. But what we can see is between the liver and the diaphragm, this white line here is a little bit of black, and that's free fluid. But it's not much. Eyeballing that's a small amount of fluid, but it is rather pointed down here, and it shouldn't be there. It's free fluid.
And when you're eyeballing it, you're using the metrics on the side of the screen to kind of eyeball what's a centimeter or so?
These are a centimeter marker, so that can help, certainly. But this is an example of a 1, and I think you can judge the difference quite easily. We've got the heart here again, we've got the diaphragm here. This is a more transverse view that we've managed to get. We've got the liver up here, but there's a large amount of black free fluid between the liver and the diaphragm there. So that would be a score of 1. So moving on to some common mistakes that we see. I don't know if you're familiar with The Hitchhiker's Guide to the Galaxy, where they say, don't panic and carry a towel. It's one of my favorite books and films. But some of the common mistakes we might see doing AFAST. We often see poor contact between the probe and the skin. So make sure you've parted the fur, because fur will trap air, and air is the enemy of ultrasound, really. It will get in your way. You won't be able to see through it. So apply plenty of alcohol and a load of gel, and then you'll get a good image. You can just use alcohol to wet down the fur, and that is often enough. The other thing we often see is poor image quality. So you can really gain a lot from learning more about ultrasound. So learning how to adjust your frequency, focal zone, depth gain, and time gain compensation can make a real difference to your image, and really what you get out of that. But I would say the most important is depth. You know, if people adjust the depth, then they'll get a much better image of what they want to see. Confusing normal with abnormal, and I think lots of vets are really worried about doing this anyway. So it's not something that should be a surprise anyhow. But the things that you might confuse as abnormal, but it's actually normal, might be fluid-filled lumens, such as the urinary bladder or the gallbladder, and blood vessels, like we saw. They're long, thin tubes or round circles when they're cut in transverse. Not understanding artifacts. So there are a lot of artifacts that we see that give us a lot of information on ultrasound, and it's really worth getting to know a bit more about those. So slice thickness artifact, refraction, mirror image artifact, acoustic shadowing and enhancement. Those are really key artifacts to understand, but you can see your anechoic black fluid. That's the important thing to watch out for. And then the link between hand-eye brain coordination, it takes practice. So don't worry, just don't be scared, pick up the probe and try. And the more you try, the better you'll get at it. So relax, don't panic, and carry an ultrasound probe. So I've got a couple of cases here. They're not blunt traumas, but they are typical cases that we'll see in veterinary practice. The first is Chad, who is a 10-year-old Labrador cross, a male. He presented with sort of a chronic part to his disease and an acute part. So he'd been losing some weight over the previous 5 months, but he presented acutely weak, almost collapsed. It's a fairly typical thing that we'll see in the emergency shift in the evening, that the dog seems just very weak suddenly. When my colleague looked at the dog, had pale mucous membranes, it was tachycardic, tachypneic, and extremely weak. Lab work was done, so x-rays. There was a lack of serosal details, so that's giving us a clue that there might be free fluid. and a mild anemia on bloods as well. So here's the images that were taken. So we can see, look, we've got some spleen and we've got some intestine. So we've got the spleno-intestinal umbilical view here. And we've got spleen, this quite normal looking spleen here, and we've got a loop of intestine here. And all around, we've got this black fluid forming triangles, and that's free fluid. Again, we've got some free fluid here. Rather than forming a nice circle, if it was in a lumen, it's forming this triangular shape here. So abdominocentesis revealed hemoabdomen. We've got a hemoabdomen and no trauma history. And so we've likely got a splenic mass. And with the concern around malignancy with hemangiosarcomas and the age of the animal, the owners opted to euthanize at this stage.
Camilla, do you use the ultrasound then to guide your abdominocentesis? You know, find the fluid pocket and then do the tap with ultrasound guidance, either live or marking it ahead of time?
I do. So I think that's, especially when there's small amounts of fluid, it's really useful for finding that pocket. It's also useful for avoiding poking the needle in a loop of intestine or a blood vessel.
Yeah, so, I mean, in humans, like, I kind of advocate the standard of care at this point is to not put any needles in patients without ultrasound guidance. You know, it just seems like why bother doing it blind when you can see where you're going?
Yeah, yeah. It's been done blind for a long time in veterinary medicine. So, but it is safer even with only very little training. It is safer because you can see what you're doing. Even if you don't fully understand the picture, you understand more than not seeing at all. So the second case is Chance. This is a bit more of a chronic case. So we've got a 12-year-old crossbreed, male neutered, weighing in at 30 kilos or 65 pounds. And we've got a history of diarrhea and bloating, and again, a bit weak, but this is, you know, getting on to being a bit chronic. On clinical examination, my colleague found palpable fluid wave on the abdomen. And the lab work showed a raised ALT, ALKP, and a raised GGT. So we'll have a look at the abdominal FAST scan results. So here we've got the diaphragmatic view. So we've got the diaphragm here, and we've got the liver here, and we can see that there's an enormous amount of fluid here. Not in doubt there. And here again, we've got the splenorenal view. The spleen is not quite in the image, but we've got the left kidney there. And then we've got mesentery and intestines down here. And we've got free fluid in between, this black in between the kidney and the mesentery is free fluid. And then here we've got the cystocolic view. So we've got the bladder, and that's interesting because that shows you how round the bladder can be. You know, when it's starting to get equal pressure from inside and out, then it becomes quite round. We can also tell if we've got a bladder in this situation, then it's very unlikely to be ruptured if we've got fluid within the bladder, because without it, it will deflate. And then this is an image that I often get asked about on my courses, that people see this and be a bit concerned about what these things are. And this is intestines that we're seeing with mesentery in between. And then all of this black area is free fluid. So enormous amounts of free fluid here. But this is normal looking intestines. It just looks very different when it's highlighted by free fluid. So the outcome in this case, the abdominocentesis revealed a clear yellow fluid. The patient was referred, and multifocal non-surgical tumours were found in the liver, and coincidentally also cholelithiasis. The owners opted for palliative management, and so the dog started on gabapentin and diuretics and twice weekly abdominal drainage to take the pressure off the chest. And the dog is still going 6 months later. So the take-home messages today, we have looked at how to perform an abdominal FAST scan. We've got the four main views: the diaphragmatico-hepatic view. There we can see the gallbladder, the pericardial space, the pleural space, the peritoneal space. The next view is the splenorenal view. So we're looking at the left kidney and we can see some retroperitoneal space and the peritoneal space. The third is cystocolic view. We can look here for bladder rupture and look for any peritoneal free fluid. And then we've got the splenointestinal umbilical view. And this is important for small bleeds because this is where gravity is going to pull any of that fluid down to. And then our fifth bonus view is the hepatorenal view, which we don't include in the fluid scoring system. And what are we looking for? We're looking for those sharp angles in that black anechoic fluid. If we've got blunt trauma, we can look at the fluid scoring system to help us assess whether we've got a small bleed or a large bleed by giving each of those four sites a score of 0, half, or 1, depending on how much free fluid we saw at each of those sites. And we need to remember the limitations of AFAST. So that it's less sensitive with penetrating trauma and that we may get false negatives with hypertension and dehydration, and that cats are more likely to get uroabdomen than dogs, and that we can't characterize the fluid from seeing it on ultrasound. And the final thing, if we do one thing, is repeat the AFAST because it really gives us an idea of whether things are improving or getting worse. And yeah, so always repeat. Thank you so much for listening today. Please get in touch with any questions, camilla@fovu.co.uk. You can check out my website, fovu.co.uk. I scan for practices around Cambridge in the UK. I review ultrasound machines, so if you are looking to buy an ultrasound machine, I have reviewed lots of them, including Clearas. I also review ultrasound books, including the book that Liscandro wrote, and that's got a review of that on my website as well. I run online courses and teach in practice. And then, as Oren said, I've got a Facebook community where we discuss all things ultrasound. Thank you very much.
Great, thanks so much, Camilla. Yeah, and we wanted to show, how Clearas really makes it pretty easy to just pick up the scanner and start going. So my disclaimer is I've done probably 1,000 FAST exams on humans, but I've never done one on a dog. So you're going to talk me through, I'm hoping, how to do it. We're going to kind of follow the see one, do one approach. So I just watched you do C1, and here's Bourbon, who's like my favorite ultrasound model ever. And so we're going to put Bourbon right lateral, correct? Yeah. Which is not a position I'm used to in the human world, but it seems like all the vets understand it. So he's going to be kind of on his right side here. And I've got some alcohol.
Yeah.
And okay, so we're going to start. You said the first view is here, the subdiaphragmatic. So I'm going to feel the xiphoid. Kind of figure that's a xiphoid. Part the fur, a little alcohol. Sorry, Bourbon's a little cold. Oh, yep, I know. Oh, cold. Okay, and let's see how we're doing.
So we just aim that a little bit more cranially. Yep. So this is the diaphragmatico-hepatic view.
Yeah, good. So here's the diaphragm, right? Here's diaphragm and heart. I can identify those. So we'll call that liver here.
Yeah. Great, so if you fan down, you'll go through the gallbladder.
Okay, let's find the gallbladder. As a bonus scan, you find the gallbladder too. Oh,
there we go.
Gallbladder?
Yeah.
Gallbladder? So, nice.
Yeah. And then rock cranially.
Rock cranial. Yeah.
Great. And then just return to your original position.
And this is where we would see the pericardial effusion. And then you were showing videos kind of fluid would really track here, it looks like, between the diaphragm and the liver.
Exactly.
Kind of the main space. Okay, great. All right. And then our next spot was, can I do it just with the same gel? Or do I need,
right,
so that's a lot of bowel gas here, right?
Yeah, that's the descending colon
Okay.
that we've got. There we go. There's the left.
There's a kidney. Great. All right.
If you fan through the left kidney.
Maybe I do need a little bit more gel. I feel like I'm losing contact here. I tried to kind of skimp. Sorry, Bourbon.
But it just shows that you can get a decent image with, you know, just
there we go.
You don't really need.
Yeah. Too much. Good. All right. So there's my kidney or Bourbon's kidney. Nice.
So fan through, rock cranially, and then return to original position. All
right. Yeah. And so you'll see retroperitoneal blood here, because that's something we don't actually see in humans, is the fluid kind of collecting retroperitoneal. It's considered kind of not reliable in the human scans. Okay, good. All right. And then from here, I'm going to go systolic, you said, right? That's
colic, yeah.
Is this too low? Or do I go kind of above up here?
Yeah. It depends. When did he go out? When did he go to the toilet last?
When did Bourbon last go to the washroom? On a tree, I should say, not a washroom, right? That's like my human. Here I am talking to humans again.
More towards the spine. Yeah.
More towards the spine.
Yeah, and slowly slide it caudally. Usually, if you can't find the bladder quickly, it's because the bladder's empty. And it's further towards the pelvis. I
can, there we go. There's a fluid-filled structure. All right, I'm going to just assume that's bladder. Yeah, there you go. It's got the wall of the bladder. All right.
Yeah, so we can just see the colon through that white vertical lines. That was colon. So again, we fan through down towards the table, because that's where the fluid's going to go.
Right.
And then we rock cranially, and then we return to the sagittal position. Nice. And we always have the probe pointing in a craniocaudal, so from head to tail position.
Great.
That's the way the organs look most normal.
Right. Okay, and then the last view was here. Maybe I'll try the alcohol again. Sorry, it's cold.
Intestinal umbilical view. So
spleno-intestinal.
So there we go.
I wouldn't even know where the spleen is in a dog, but here you go. It's that easy, right? Oh, amazing. All right.
Yeah. So
that's how easy it is. All right.
So again,
this is spleen. This is the spleen, the big gray thing. Nice.
That's the spleen. Okay. And then there's lots of loops of intestine around there as well. And when we fan down towards the table, we're like you said, getting to the most sensitive area, because that's the lowest point of gravity in the abdomen. So
somewhere kind of this edge of the spleen, right before it disappears, somewhere around here would probably be the most sensitive, you think?
Yeah.
Nice. Okay, and then I'll kind of fan all the way through up it. Okay, and now I'm probably back over to liver. Nice. Great. Well, thanks for that, Bourbon, and thanks for walking me through that, Camilla. That was great.
No problem.
All right. So before we hand it back to Janez, I see the Q&A is chock full of questions, which is great. Please keep loading the questions into the Q&A. We'll definitely have time to get to some of those. And, I just kind of want to summarize where really I think we kind of help demonstrate 5 ways point of care ultrasound can really help in not just emergency, but in any of your clinical care with your veterinary patients. We saw how, you can imagine in some of these cases, trying to do radiography, especially on the smaller amounts of fluid, is really kind of a guessing game to try and find these small pockets where really the ultrasound excels in finding fluid in the abdomen. And you see it pretty instantly for a quick diagnosis, and then you get it real time. So instead of guessing on the fluid waves and percussion, you get rapid diagnosis. And in some cases, this can prompt life-saving maneuvers, especially things like pericardiocentesis, or if a patient needs a blood transfusion or emergent surgery, far quicker than you're going to get before you get your blood work back or any other advanced imaging. And you saw it's cage side, low impact, minimal restraint, no shaving required, spares the radiation, it's entirely safe to the animals. And the app-based point of care ultrasound is really easy and gets you going right away, pretty much at the point of purchase. It's you kind of get it off the shelf and it's good to go, plug it into your smartphone. You can see how I was kind of toggling with depth and gain, made it really simple. And I think Camilla would 100% agree that nothing's kind of easier than app-based ultrasound. So I want to make sure we save time for your Q&A for questions. There's so many. I'm not sure we're going to get to all of them today, but we'll definitely follow up with everybody. But stay tuned and we'll fire through as many as we can. I'm going to hand it back to Janez first to bring it home.
Thanks, Dr. Frankel and Bourbon for the live demo. And thank you, of course, Dr. Edwards for sharing the latest AFAST techniques and best practices. Now, just before we start our live Q&A session, I'd like to take a minute to introduce you all to Clearas HD VET for the highest definition wireless ultrasound imaging to speed diagnosis for small, medium, and large animals. What you saw today was our C7 microconvex VET scanner, which is specifically designed for clear clinical imaging for small and medium animals like cats and dogs and Bourbon. We also have the C3 convex VET for larger animals and the L7 linear VET for equine MSK. Our family of VET scanners deliver several advantages. Clearas is unrivaled for high resolution imaging and handheld ultrasound with dedicated animal presets. It shows you the fine details you need to investigate an area of concern, perform a FAST exam, and make a confident diagnosis on your patient's first visit to expedite the right treatment plan. Each scanner is designed with 8 beamformers that deliver the image quality and speed only found in traditional systems, but at a fraction of the cost. Artificial intelligence replaces complex knobs and buttons, making our scanners fast and easy to learn and use. Clearas is also wireless with zero footprint for high portability to scan animals where they are, from the vet clinic to homes, right at the cage side. You get free movement with no more wires getting in the way or startling the animals, and it also makes it so much easier to clean and disinfect. Your Clearas scanner comes with a free ecosystem with 0 subscription fees that include free apps for your iOS and Android devices with free updates, unlimited cloud storage to capture and manage your exams, and unlimited users at no additional cost. Clearas Live delivers one-click telemedicine if you'd like to share live scanning with a colleague for a second opinion. With increased ultrasound billings, you'll see a rapid return on your Clearas HD scanner, which is ultra affordable. Now, just a quick poll. So before we go into our live Q&A, we've got so many wonderful questions. We're going to have a question for you. If you'd like more information, we'd be happy to provide you more information about Clearas and which scanner might work best for your veterinary practice. We do offer Clearas in over 90 countries, so if you'd like quote and pricing information in your region, please do select that option and we'll have somebody contact you with local pricing information. If you'd like to opt to speak to one of our experts about the advantages of wireless ultrasound, if you are new to ultrasound, this is a great option. If you'd like to discuss scanner features and comparisons to maybe a scanner you already have, we'd be happy to do that. And we encourage you as well to book a live demo with one of our clinicians. Zoom, when there's thousands of people attending, is a little bit slow. With a one-on-one Zoom demo, you'll get to see the real image clarity that our scanners deliver. And if you'd like us to send you more video tutorials, we'd be happy to do that as well. So you can select as many options as you wish here. I'll give you 5 more seconds. 4, 3, 2, 1. Thank you so much. We're going to just close that poll here and we'll get back to you in the coming week. Now, just before we move on to our live Q&A, we do have one final poll for you. We'd like to actually invite you to save your seat for our next webinar, Veterinary Focus Differentiating Primary Cardiac from Pulmonary and Pleural Diseases. On September 22nd, we'll be welcoming back the dynamic duo, Dr. Soren Boysen and Dr. Serge Chalub from the University of Calgary, big proponents of POCUS for quickly assessing small animals. They have a combined total of more than 25 peer-reviewed articles and book chapters on the subject of veterinary lung ultrasound. Save your seat with this poll and join us in September as Drs. Boysen and Chalub share POCUS techniques to determine if a patient presenting with respiratory distress has primary cardiac, pulmonary, or pleural space disease with an emphasis on diagnosing congestive heart failure. To save your seat, simply click yes in this poll and we will send you a confirmation email in the coming days. Okay, 3, 2, 1 to save your seat. We'll close the poll. Now, without further ado, let's begin the live Q&A session. Please use the Q&A icon in the menu bar to ask your questions for Dr. Edwards. I do want to let everyone know that in the coming days, we'll send you an email with the recording from today's webinar, as well as a copy of the presentation and a link to the vet show where you can redeem your CE or CPD credit. I'd like to welcome back Dr. Oren Frankel to moderate our live Q&A session.
Sure, yeah, let's jump in. So many good questions. One that came up a lot, Camilla, is can you use the ultrasound on smaller animals? There's a question particularly about birds people brought up and smaller reptiles.
Yeah, so definitely it is something that is emerging. I don't personally see any exotic animals, but there is a whole section in the Scandro's book on other animals. I've actually got it with me. I'm just looking at that.
Nice.
So yeah, it's got a whole chapter on exotic species in that book. So so yeah, absolutely, it can be used. Focus can be used in exotic species as well.
Maybe I'll combine a couple of these questions together, which is how do you learn enough ultrasound and what is enough to trust your interpretations?
Yeah, so if you're doing full abdominal scanning, you do need to practice a lot to get secure in the knowledge of what normal is and what abnormal is. But there's been studies that show it really is quite minimal training you need to be able to do AFAST and be confident that you're seeing free fluid in the abdomen. I saw one of the questions concerning sometimes fluid can appear a little bit more like the parenchyma of organs because it might be highly cellular and but you often will still see a flow or a movement to it that shows you it's fluid, but usually it will be anechoic. Black fluid that we're looking for. Yeah.
Great. Here's a question about positioning. You know, and this kind of came up in our last webinar about animals' position of comfort. If they're in respiratory distress, sometimes they're on their belly, and that's where they feel best. In sternal position would be the best term, right? You know, and so are you still able to do the AFAST? How do you modify it? And then how do you respond to that?
Yeah, there's you know, there's lots of studies now on doing AFAST in different positions. The standard is right lateral, but it can be done in many different positions. I find if they are sternal, sometimes just putting the back end of their body into right lateral, so putting their legs underneath them can be enough. So basically their abdomen is mostly in right lateral, but they're still sitting in sternal, so they can still breathe easily. That's good enough. You know, we don't want to, the benefit with this is that we don't need to harm our animal to get this information. So with X-ray, we would need to lie them on their side to get the optimum view. But, you know, with AFAST, we can just view them where they are comfortable.
Or adaptable.
Yeah.
What other applications are you using ultrasound for in the abdomen in dogs and cats?
So ultrasound in general, I mean, ultrasound is phenomenally useful for viewing things in the abdomen. Just trying to think of case today where I saw an old cat that was experiencing diarrhea, and we were able to find an abnormality in the intestines that sadly look like lymphoma, but we can take samples of that and incredibly useful quick diagnostic tool to move the case forward and get answers.
So are you using the Clearas, for instance, to do like kind of more comprehensive abdominal and pelvic scans beyond the AFAST?
Yeah, can definitely use it for a full abdominal scan. That's definitely it's a really high quality image. So yeah, I can definitely use it for the full abdomen.
One question has come up a few times here, so hopefully that will address it, is the repeat of the FAST exam. You mentioned, you know, the importance of repeating for monitoring. What time frame do you recommend? A lot of people want to know, you know, what's the number, or how does that fit into your clinical practice? What's
the magic number?
Yeah, what's that?
Yeah, yeah. So I guess it depends. So if you're rehydrating an animal, you usually do that over a longer time frame than giving fluids for shock. So if you're resuscitating rehydration wise, then you might not need to do it quite so frequently. You might be just monitoring, a couple of times a day to see. It also depends on, if the animal's suddenly deteriorating, then do it then. But yeah, you could be in a situation where you're worried about a bleed. An animal comes in and it might be a small bleeder, and you want to manage it without surgery, but you need to know whether that's a worsening situation. Then you might want to do it every half an hour. So it really does depend on the case, I think. Yeah, and I'm not sure if there are studies out there that have checked the frequency in different cases, but I would say it entirely depends on the case that you've got in front of you.
Yeah, in humans, they've looked at a couple different time frames, 15, 30 minutes, no one really knows. Basically, we always watch for clinical deterioration, or serial monitoring is pretty vague and a wide range similarly.
Yeah.
How often do you see solid organ damage? I'm kind of modifying a question about the source of bleeding that a few people want to know. So do you see the solid organ that's injured, or do you just see the blood, or both?
You usually just see the free fluid. That's a good question. Often if it's a tumor that's bleeding, you might see the tumor and you put two and two together. But yeah, to actually see the source of the bleed, no, I can't say that I've ever noticed that.
Okay.
Yeah. Often there'll be, it'll be in a particular area. So often you might see free fluid more in the cranial abdomen than the caudal abdomen if the bleed is in the cranial abdomen. But yeah, precise organ is not so common that we see that.
And you're also using the ultrasound then to extend into the thorax too? Could you, I know we didn't really cover that as a content, but a lot of people want to know a little bit about it.
Yeah, so we can definitely see, we can see the diaphragm, that bright white line that we saw in front of the liver. And beyond that, often we just see gas. So that means really that we don't see anything at all other than white out in that area. But we might see, if there's fluid, we'll see black on that side of the line. If it's in the pleural space, it will be quite spread out. Whereas if it's in the pericardial space, we'll see it close around the heart. And sometimes if the heart is right up against the diaphragm, we'll see that normally through the diaphragm as well. So don't be alarmed if you see the heart, that is normal, but we shouldn't see any fluid around the heart. And then we might see something called B lines, but that's really moving into thoracic fast scanning. So that tells us about, that's more sort of vertical lines that might tell us that there's left-sided congestive heart failure. We've got pulmonary edema going on.
That's a great segue into the next webinar with Soren and Serge. They are lung ultrasound aficionados, I would say. So stay tuned for that. More on that content. I love, we're almost at the top of the hour, but I love this question. I'm going to read it verbatim. Any tips on getting vets to just switch on the machine and just see what they can see and get over the fear of failure to get an answer? Yeah,
so that is what I live for. I love getting vets to switch on the machine because it is terrifying, but when you can actually do it and you can switch it on and go for it, and you can do more than you think you can. I've got a handy guide on my website for breaking it down as simply as possible. But yeah, it's just a question of switching it on and give it a go, because you can't harm the animal with ultrasound. So just do it.
Yeah, that's great. And, you know, for the way we train humans is to just do what you normally do, but add the ultrasound for your learning in the beginning. And as you compare to what you normally do, you see what's right. You see where you're accurate, where you're inaccurate, compare, learn, move forward. The same way we all learned medicine in the first place. We just kind of had a lot of hand-holding earlier on in our practice.
Yeah, I'm not sure we get as much hand-holding as doctors do.
Yeah, well then you should feel more comfortable, I guess, just sort of going out there into the world.
What a great closing message. We've now reached the top of the hour. If we didn't get to your question, and there are about 50, 60 questions, so if we didn't get to yours, we will follow up with you by email in the coming week. Again, you will all receive a copy of the slides and webinar recording and a link to redeem the CE CPD credit from the Vet Show website. I'd like to conclude by thanking the star of our show, Dr. Camilla Edwards, and our furry supporting characters, Pippi and Bourbon. Thank you all for joining us today. We look forward to seeing you again on September 22nd for our next webinar with Drs. Soren and Boyson. See you all again very, very soon.